Hello everyone, I'm Pratibha, Assistant Professor of Sociology from Government Pacific College, Siddharth, Mysore. Today's presentation is on the topic Population Policies and Programs in India Need and Rationale. Session outcome will be students will become aware of the population policies and programs of the government. Contents of the slides are Introduction, Objectives of National Population Policy 2000, National Socio-Demographic Goals, Family Welfare Program, New Interventions under Family Planning Program, references made, and there are 5 multiple choice questions. Now let's see the meaning of population policy. The policy framed by the government to effectively control the population explosion is called population policy. According to Berelson, the rules, laws, and programs implemented by the administrators to control the population are called population policies. As you all know that India is the second most populous country in the world, and the world population is observed on 11th July every year. In India, the first national population policy was formed in the year 1976. In the post emergency period, the government announced a new population policy in 1977. In the year 2000, on 15th February, National Population Policy was formed with the following objectives. They are immediate objectives, medium term objectives, and long term objectives. Now let's see what were immediate objectives. To address the unmet needs of contraception, healthcare infrastructure, and health personnel, and to provide integrated service delivery for basic reproductive and child health care. As you are aware of the fact that, especially in rural areas, there are no adequate healthcare facilities, and healthcare personnel are also not more in number. Hence, those unmet needs uh, were to be met with, hence, they form the immediate objectives. Along with that, um, integrated service delivery for basic reproductive and child health care also form the immediate objectives. Now let's see medium term objectives. To bring the TFR, that is total fertility rate, to replacement level by 2010 through vigorous implementation in intersectoral operational strategies. Long term objectives were to achieve a stable population by 2045 at a level consistent with the requirement of sustainable economic growth, social development, and environmental protection. For any country's growth and development, along with economic growth, social development is also essential along with environment protection. So these form the long term objectives. National social demographic goals, which were set to achieve by 2010, address the unmet needs for basic reproductive and child health services, supplies, and infrastructure, make school education up to 14 years free and compulsory, and reduce dropouts at primary and secondary school levels to below 20% for both boys and girls. Education is made free and compulsory up to the age of 14 years um, in order to encourage uh, children to get education, and especially in rural areas, the dropout rate amongst girls is more. That is because parents, most of them are illiterate or not so educated, hence, they may not realize the importance of educating their daughters. Hence, they may make their daughters discontinue their studies, shoulder them with household responsibilities, or send them for some kind of petty jobs. So, in order to prevent all that, uh, especially to reduce dropout rates at primary and secondary school levels, um, to below 20% for both boys and girls. uh, the goals were set. Reduce infant mortality rate to below 30 per 1,000 live births was also one of the goals. Infants are those who are less than 1 year of age. So, the reasons for infant mortality would be negligence on the part of the mother, environmental factors, um, not getting timely treatment. Um, Many more reasons would result in infant mortality. To reduce this to below 30 per 1,000 live births was one of the goals set. Reduce maternal mortality rate to below 100 per 1 lakh women dying at the time of delivery or after delivery, um, is called as maternal mortality. Their reasons, um, may be due to anemia, lack of timely treatment, um, negligence on the part of women, lack of nutritious food, and necessary care would result in maternal mortality. Hence, to reduce this to below 100 per 1 lakh was also one of the goals set. Achieve universal immunization of children against all vaccine preventable diseases. So, for this, awareness is given for the parents to get immunization, um, for children. ASHA workers play a significant role in visiting household to create awareness and to bring them uh, to primary health centers in order to get their children immunized against diseases. Promote delayed marriage for girls not earlier than age 18 and preferably after 20 years of age. So, when girls um, are married at later ages, and that means to say after 18 years of age, till then at least they'll get an opportunity to get education, and once they are educated, they can think of their future and have a bright future ahead. Achieve 80% institutional deliveries and 100% deliveries by trained persons. Um, Even to this day, in rural areas, some of the deliveries are held at home by untrained persons. This may result in um, the death of the women at the time of delivery, and there may be incidences of the child also um, being affected. Hence, to prevent this, 80% institutional deliveries are encouraged and 100% deliveries by trained persons are also encouraged. Then, achieve universal access to information, counseling, and services for fertility regulation and contraception with wide choices. So, for women, necessary counseling and information, along with the services for fertility regulation, are given. That is mainly because women may, because of hesitation, they may not come forward in getting counseling. So, once they are provided with right kind of information, they may come forward in adopting family planning measures. And to achieve 100% registration of births, deaths, marriage, and pregnancy was also one of the goals. So, by registration of all this, an exact number of population can be known, and this would be helpful for civil registration system also, where a country can maintain proper data of its population. Then control the spread of AIDS and promote greater integration between the management of reproductive tract infections, that is RTI, and sexually transmitted infections, and the National AIDS Control Organization. AIDS, which is acquired immunodeficiency syndrome, um, is spreading worldwide. Millions of people have been affected by this, and to control the spread of this disease, awareness programs, campaigns are organized, and necessary measures are taken to prevent the spread of AIDS. Prevent and control communicable diseases is also another goal set. Integrate Indian systems of medicine in the provision of reproductive and child health services and in reaching out to households. Promote vigorously the small family norm to achieve replacement levels of TFR. Bring about convergence in implementation of related social sector programs so that family welfare becomes a people-centered program. Now let's see family welfare program. India is the first country in the world that launched family planning program in 1952. Later, in the year 1977, family planning program was renamed as Family Welfare Program. The Ministry of Health and Family Welfare is the government unit responsible for formulating and executing family planning in India. An inverted red triangle is the symbol for family planning, health, and contraception services in India. So, in addition to the government campaign, improved health facilities, the increased education for women and higher participation among women in the workforce have helped lower fertility rates in many Indian cities. Of course, education is one of the contributing factors in reduction of fertility rates, because educated women can plan for her family, and improved healthcare facilities definitely has contributed in betterment of health conditions of the people in the country. And those women who are working, uh, they also have come forward to a greater extent in adopting family planning measures. The objectives of the program are positioned towards achieving the goals stated in several policy documents. While India is improving with fertility rates, there are still areas of India that maintain much higher fertility rates. That is because, mm, again, it's due to lack of awareness, sometimes conservatism. Family members may not allow women to adopt family planning measures. Hence, it has resulted in high fertility rates in some of the areas. Family planning program benefits not only parents and children but also to society and nation by being able to keep the number of new births under control, allows for less population growth. With the less population growth, this will allow for more resources towards those already existing in the Indian population. With more resources comes longer life expectancy and better health. India has plenty of resources, and the need of the hour is proper utilization of resources. And no doubt the resources are being properly utilized, which has resulted in better life conditions for people in India, and the life expectancy um, is also has also improved. Now let's see new interventions under family planning program. Scheme for home delivery of contraceptives by ASHAs at doorsteps of beneficiaries. Um, ASHA, the abbreviation, which is Accredited Social Health Activist. Their services are taken to deliver family planning um, measures, information to the doorstep of the people. This particular um, intervention program, um, this particular scheme is operational from 16th May 2012, wherein ASHA services are utilized to give counseling for the newly married couples, to encourage newly married couples to have children after 2 years of their marriage, and to have spacing between the first child and the second child. Post to spacing methods by introduction of new method, PPIUCD, postpartum intrauterine contraceptive device, assured delivery of family planning services for both IUCD and sterilization. Scheme for provision of pregnancy testing kits at the sub-centers as well as in the drug kit of the ASHA for use in the communities to facilitate the early detection and decision making for the outcome of pregnancy. Then reproductive, maternal, newborn, and child health, that is RM and CH counselors, are also engaging in counseling activities. Family Planning 2020. Family Planning Division is working on the national and state-wise action plans so as to achieve Family Planning 2020 goals. The key commitments of Family Planning 2020 are increasing financial commitment on family planning, whereby India commits an allocation of 2 billion USD from 2012 to 2020, ensuring access to family planning services to 48 million, that's 4.8 crore additional women by 2020. Sustaining the coverage of 100 million, it's 10 crore women currently using contraceptives, reducing the unmet need by improved access to voluntary family planning services, supplies, and information. So, in addition to the above, Janasankhya Sthirata Kosh, National Population Stabilization Fund, has adopted the following strategies as a population control measure. The first one is Prerna strategy. Janasankhya Sthirata Kosh has launched this strategy for helping to increase the age of marriage of girls and delay in first child and spacing in the second child in the interest of health of young mothers and infants. The couple who adopt this strategy are to be given some incentives. See, increase in marriage of girls and encouraging them to avail education would result in a better future for girls. So this gives them an opportunity to get educated. They may even come forward in engaging themselves in some creative work for their family, supplement their family income. Along with that, they may plan ahead for the future, and education plays a significant role in shaping the future of women. Santushti strategy. Under this strategy, Janasankhya Sthirata Kosh invites private sector gynecologists and vasectomy surgeons to conduct sterilization operations in public-private partnership mode. The private hospitals, nursing home who achieve target to 10 or more are suitably awarded as per strategy. National Helpline. Janasankhya Sthirata Kosh Also runs a call center which provides free advice on reproductive health, family planning, maternal health, and child health, etc. Women who are hesitant um, or who does not prefer to visit PHC to avail any kind of counseling personally, they may bring up to the helpline and get advice or counseling and may come forward in adopting family planning measures and improve their and also improve their health conditions. JSK, as a part of its awareness and advocacy efforts on population stabilization, has established networks and partnerships with other ministries, development partners, private sectors, corporate and professional bodies for spreading its activities through electronic media, print media, workshop, walkathon, and other multi-level activities, etc., at the national, state, district, and block level. And a lot of measures have been taken to reach out to the people. Uh, Again, in 2017, Ministry of Health and Family Welfare launched Mission Parivar Vikas, a central family planning initiative. And through this, services are assured and commodity security and accelerating access to high quality family planning services are provided. Its overall goal is to reduce India's overall fertility rate to 2.1 by the year 2025. And these are the references made, these are the websites referred. And now let's see the multiple choice questions. First national population policy was formed in the year. Answer is 1976. World Population Day is observed every year on 11th July. National Population Policy 2000 was implemented on 15th of which month? February. Ministry of Health and Family Welfare launched Mission Parivar Vikas in which year? Answer is 2017. Which country in the world first launched family planning program? That's India. I hope you have understood the topic. Thank you.